Joining us now is Dr. Tom Frieden. He's the former director of the Centers for Disease Control and Prevention and now the president and CEO of the organization Resolve to Save Lives. Dr. Frieden, great to have you with us. I confess the reason that I wanted to have you on is we were speaking with Jeremy Conondike last week about this outbreak as it unfolded. And he said back when he was running point for USAID in 2014, 2015, this was your full-time job, that you as the head of the CDC had a complete focus on the Ebola outbreak. I'm curious, as you look at the response thus far, if you have confidence that somebody within this administration is doing just that, paying as much attention to this outbreak and focusing on containing it.
Well, I'm not directly involved, so I can only comment as an outsider. I do see the U.S. providing some financial assistance, and I do see many scientists, doctors, nurses, lab experts at CDC very dedicated to trying to stop things. But it is a world of difference. And I think first we have to start with what the context is. This is going to be really hard to control. Just to give you a flavor of that, by the time we started responding in 2014, there were between 40 and 50 cases. By the time the world started responding this year, there are between 400 and 500 cases.
And why is that? Is that partially because the reporting structure was reliant on things like USAID that are just no longer there?
You know, to be blunt, I think that's what some people are saying. I think that's a knee-jerk response. It may or may not be correct. I don't know that. There are plenty of reasons to explain a delayed detection without that. And there'll be plenty of time to assess whether or not that contributed. The point right now is we need an emergent, immediate, meticulous response just so quickly. I can't express just how important it is to work with urgency. And the reason for that is with Ebola, what we figured out in West Africa, and I went there multiple times and worked with the teams. We had fantastic staff. You know, when I ran CDC, all 158 disease detectives went to Ebola. Went to respond to the Ebola outbreak at some point. We had close to 4,000 people working. Within days, we had put 50 people in the field in the 3 countries. We had on average 200 people a day in the field, 400 working at CDC. For years of this outbreak. But what we found early on was that if you get there in days, you can stop it in weeks. If it takes weeks to get there, it's going to go on for months. And if it takes months, it may go on for years. So we really need to surge in support, understanding that 90% of the response will be local doctors, nurses, community leaders, but still they need funds, they need logistics, and they need some partnership on some of the more specialized elements of care and disease detection and control.
Walk us through what you make of the plan that was floated, I guess. It's been struck down by a Kenyan court here to have a quarantine facility in Kenya for those from the U.S. who have been exposed to Ebola. What do you make of that? I know that some pushback against this that I've seen is that if you have been exposed, there's no way for you to get back to the U.S. to get treatment here. What do you make of the plan that has been floated there by the U.S. government?
Yeah, I don't know the details of it, but fundamentally, if we're talking about people who are going over to fight the epidemic, that's kind of equivalent to our warfighters who we send into danger areas. And if they get hurt, we expect to bring them back to this country and treat them as the returning heroes they are, not to put them in some slapped-together facility somewhere. The other thing to say is it really is important that people get good quality care as quickly as possible if they become ill. Even though there's no proven treatment for this particular strain of Ebola, supportive care makes a really big difference. It can make the difference between life and death. We stopped the 2014-2016 epidemic without a significant contribution from vaccination or treatment. So it's possible to do with the core public health activities of isolating patients, providing safe and dignified burial, contact tracing, and then quarantine and care for contacts who become ill.
Given where this outbreak is right now, Secretary of State Marco Rubio has said, quote, "We cannot and will not allow any cases of Ebola to enter the United States." Do you think that's a reasonable goal? And was that the goal in the past for these kinds of epidemics?
Well, it's certainly a goal. How realistic it is if this spreads widely in Africa is very questionable. People travel for business, for tourism, for family reunification. People have contacts. People go from one country to another and then come here. So really, there's no way to build a moat around the United States and keep everybody out. It is reasonable to reduce the risk that there will be any spread in the U.S., and there are really good ways to do that. But what we did during my time leading the CDC was when a couple of Americans got sick overseas, we have a special biocontainment airplane that went, picked them up and brought them to a biocontainment facility at Emory University in Atlanta. And both of them survived and nobody else got infected. And that didn't serve as a deterrent for people to go stop the outbreak there, understanding that they would be well cared for if they became ill.
I remember that. I remember that flight coming back and us live on the air where I was working at the time, tracking that movement of that patient all the way to that hospital.
Let me ask you, Dr. Frieden, about the loneliness of the WHO director making the trip to Democratic Republic of the Congo to see this firsthand. In the past, somebody in your previous position might have gone. We don't currently have a permanent head of the CDC right now. Use that as a jumping off point, if you would, just to talk about the way that the WHO, the global health apparatus, is operating here without the cooperation of the kind of hand-in-glove relationship that we would have seen in the past between the U.S. public health infrastructure and global public health infrastructure.
There's a bottom line here. For all of its problems and challenges and weaknesses, the WHO is absolutely essential. There is no replacement for it. There's no way for bilateral engagements to make the kind of interaction and intervention that the WHO can. And the stronger WHO is, the safer we are as a country. During my time at WHO, Margaret Chan was the director. She and I were in almost daily telephone communication. We were very closely coordinated. We provided dozens or even hundreds of staff to support and strengthen WHO. In the past decade, WHO has gotten stronger. They created a new emergencies unit that's more capable of responding to things like this. But the U.S. was always in the lead along with WHO, and now we're really kind of on the sidelines. And that also means that we have less intelligence, less information about what's really happening. We haven't paid our dues to WHO. We walked away from WHO. We pulled out overnight several dozen CDC experts who were embedded with WHO, helping them to do a better job. And fundamentally, when we turn our back on an organization like WHO, we can't improve it, and we are less safe.
Talk to us a little bit about what this virus is like and what this strain of this virus is like. It's not as contagious as something like COVID, right? You have to come into direct contact with it. But I think the reason it is so scary is because the outcomes can be very bad. If you are in a facility that is not what you've got in Atlanta, it's not all this supportive care, how do you treat it? And what is the best way to prevent the spread given the resources a lot of people have at their disposal?
Ebola is a scary disease. It kills a significant proportion of the people who are infected. It kills in some horrible ways, including bleeding and loss of body fluids. And it spreads through close contact, especially with people who have died from Ebola, who have a huge number of organisms. And that's one of the reasons it's just not in the cards for Ebola to spread widely in this country. We don't have the kind of burial practices or health care that would lead to widespread transmission. On the other hand, it is certainly possible that a traveler will come into this country, as one did in 2014, 2015, with Ebola or without Ebola, and develop symptoms of Ebola, go to an emergency department or a doctor's office. And that's why for the general public, there's really no cause for concern. For doctors and nurses working on the front lines, keep an eye out for people who have traveled. But there's one issue beyond this that I think is really important to emphasize. Even though this strain of Ebola and this Ebola outbreak is not going to cause a pandemic, it's not going to cause a significant risk to large numbers of Americans, it's a stress test. And it's a stress test the world is not doing well at. I would say so far we're failing. And that bodes ill for the future. That means that the next time there's a pandemic, and there will be a next pandemic, we are not well prepared. Our defenses are down. The WHO needs to be stronger. The CDC needs to be robust. And what we saw in recent weeks is another deadly blow to the US CDC. In the past, we've seen 3,000 staff pushed out, virtually all leaders of the CDC gone, acting part-time. Now what we've seen is the State Department halt more than 100 different contracts CDC has with organizations around the world that provide care for 8 million people living with HIV and that can support finding problems quickly and stopping them soon. That plan is to roll out in the coming weeks, and it would result basically in the CDC having to call back hundreds of disease detectives, shut offices, outposts in countries where we can support countries to find and stop outbreaks faster. This is something that would not only devastate CDC's global health footprint, but make Americans much less safe. So if this plan of the State Department isn't paused and done in a careful, thoughtful way, we will be even less prepared for the next pandemic.